stock in your heart. The American Heart Association finds nearly half of all adults in the U.S. have some form of cardiovascular disease.
And while you may already know the main culprits like high blood pressure and high cholesterol, obesity, and a history of smoking, there are other unexpected risk factors that can present a heart-stopping surprise. Wing News Health and Medical reporter Amy Osher has our details.
More than 800,000 people each year suffer a heart attack, and 1 in 5 heart attacks is silent. The person isn't aware of the damage that's being done.
I had a patient who had a toothache that turned out to be her symptom for having a heart attack.
That's not the only thing you need to know. Where you live plays a crucial role. The American Heart Association found southern states have the highest rate of death by heart disease. They believe it's because more people live in poverty with less access to fresh fruit, safe places to walk, or access to health care. The quality of your tap water also has an impact. Researchers at Columbia found people exposed to high levels of arsenic in their drinking water were 42% more likely to develop heart disease. But don't replace water with diet soda. Women over 50 who drink 2 or more diet sodas or any kind of artificially sweetened drinks a day face an increased risk of stroke and heart attack. Even what happens during pregnancy impacts a woman's heart health. Complications like gestational hypertension, preeclampsia, preterm birth, and gestational diabetes significantly increase the risk of developing cardiovascular disease later in life. And if a woman hits menopause before they turn 42, new research shows the odds of having a heart attack or stroke may be twice as high than if you go through it later.
You thought?
Meanwhile, having constant low-level stress can cause you to be 40% more likely to have a heart attack. The doc's best advice? Surround yourself with good people and be good to yourself. Amy Osher, Wink News.
Amy, thanks. Now, if you think that heart disease begins in your 50s, think again. A study published in JAMA finds our heart health begins to decline around age 10 if children have unhealthy lifestyles, and that includes poor diet, lack of exercise, and smoking. Those early habits significantly increase the risk of heart attacks and strokes later in life.